Health officials are asking for an act of Congress to fight the Zika virus. Lawmakers have yet to earmark those funds needed to develop a new vaccine for the virus, and the list of possible Zika-related birth defects continues to grow. Joining me now, Dr. Devi, an associate professor at NYU School of Medicine. Thanks for being here.
Oh, thank you.
You know, this is something that doctors and women and anyone of childbearing age has been watching so closely. One of the most interesting things we're seeing now is that there's a possibility that the birth defects may be more severe than they'd initially thought. This from Scientific American just published research to be presented next week at the Teratology Conference in San Antonio, Texas, suggests that serious joint problems, seizures, vision impairment, trouble feeding, and persistent crying can be added to the list of risks from Zika exposure in the womb. So that goes beyond the small heads and the brain damage that they were so initially concerned about.
Sure. All of these things are problems. I mean, the small head and the small brain, of course, you know, that can be devastating, but even joint problems can impair someone's functionality, right, for life. Seizures, medical problems for life. So for both that child and for the family, this can be really, it can destroy their lives.
Is that one of the big concerns here? Is there's so much we don't know and we keep learning more?
Sure. I mean, if we had more money, right, more funding for this, then it would be possible to at least find out about Zika at the different stages. So, for example, even at the mosquito stage, how is Zika being spread? And then later on, as it kind of passes through the body and infects the baby, what's happening there? I mean, there's so much to find out and so many stages that we still need to explore further.
Yeah, and we have yet to see that action from Congress, that next step, failing to put the money where so many people think it belongs. But you know, there was money for Ebola, and yet that feasibly didn't have the impact that Zika could possibly have. Is that right?
Yeah, so it's interesting that you bring that up, because I think actually with Ebola, you know, people got distracted by that. They got really panicked and worried, and then because we didn't see the same scale of threat, then people feel a little bit less concerned about Zika afterwards, like maybe this is a false alarm. I mean, but there are huge differences between the two. So Ebola was a lethal virus, right? But we had treatments that could actually protect you. So if you got infected with Ebola, you needed different types of care that would actually keep you alive. That's why no Americans actually perished from Ebola here in the US. But with Zika, we don't have a treatment, we don't have a virus, and even if you find out while you're pregnant that you actually test positive for Zika or that the fetus might be infected, there's nothing we can actually do. We just watch and wait and monitor.
But yet the impact can be catastrophic.
Of course. I mean, if these children, so first of all, we're assuming they're born, but there are a lot of miscarriages and stillborn births,
exactly.
Right? So even then, you know, put that aside, and then you have the children that are actually born. I mean, think about not just in the U.S., but for some place like Brazil, where most of the population is the younger population. I mean, that can devastate the entire economy, the fabric of the country.
Yeah, one of the arguments, and this, of course, would take money, is that states need to get out there and start killing the mosquitoes now. Would that have an impact?
It could. I mean, there are different things that have been put out there, like genetically engineered mosquitoes that might be able to fight these mosquitoes with Zika. There's also the idea that there's some bacteria that can fight Zika. So if you infect the mosquitoes with this bacteria, maybe that will actually stop the spread of Zika. I mean, we've tried to stop mosquitoes in the past, not just for Zika, but for dengue virus and a whole host of other diseases, but we haven't succeeded. So I think we really need to explore these creative solutions to try to stop this.
Just anything you can give advice for folks for women that may be seeking to conceive or are pregnant now?
Sure. So the CDC has actually issued a travel warning for many of the Caribbean countries and South American countries. So people should just check that website. If they can avoid travel to those places, then avoid it. If you do go, let's say you're not pregnant or you're thinking about getting pregnant, the CDC advises waiting 8 weeks before actually trying again. And if you're a man, you might think that, well, I'm not pregnant, I'm not specifically trying to get pregnant, but you could still get someone pregnant and you could still infect someone who is pregnant or doesn't realize that they're pregnant right away, right? So it's still worth being cautious.
Yeah, and so much monitoring yet to come right here in the home front. Thank you so much, Dr. Devi. We appreciate it.